osseous components of the tibia in the anterior view include the medial malleus, the articular facet of the medial malleus, and the inferior articular surface. In the posterior view, we see the same three landmarks. The osseous components of the distal fibula in the anterior view include the lateral malleus and the articular facet of the lateral malleus, and in the posterior view, the lateral malleus, the malleolar fossa of the lateral malleus, and the fibular notch. There are 7 tarsal bones of the foot: a calcaneus, talus, cuboid, navicular, and a medial, intermediate, and lateral cuneiform. There are 5 metatarsal bones. The first metatarsal is on the big toe, the second, the third, the fourth, and the fifth metatarsal is on the little toe, the base is proximal, and the head is distal. There are 14 phalanges. There are 5 proximal phalanx, 4 middle phalanx, and 5 distal phalanx. The big toe has just a proximal and a distal phalanx. The base is proximal and the head is distal on the phalanx, and the 5 distal phalanx have a tuft at their distal end. The deltoid ligament is a large, strong ligament that reinforces the ankle joint medially. It originates at the medial malleus of the tibia and fans out to attach distally to the talus, calcaneus, and navicular tarsal bones. It has 4 different components that help stabilize the ankle joint during eversion of the foot and prevent subluxation of the ankle joint. There are 3 lateral ligaments that reinforce the ankle joint laterally. The anterior talofibular ligament extends from the lateral malleus of the fibula to the neck of the talus. The posterior talofibular ligament extends from the malleolar fossa of the fibula to the lateral tubercle of the talus. And the calcaneofibular ligament extends from the lateral malleus of the fibula to the lateral surface of the calcaneus. The arches of the foot allow for weight-bearing capabilities and foot movement. There's a medial longitudinal arch and a lateral longitudinal arch, and then a transverse arch over the cuneiform and cuboid tarsal bones. There can be dorsiflexion and plantar flexion at the ankle, as well as inversion and eversion of the foot. Dorsiflexion is limited by the posterior joint capsule. Plantar flexion is limited by the anterior joint capsule. Inversion of the foot is limited by the lateral joint capsule, and eversion of the foot limited by the medial joint capsule.